Shlomo, welcome. I heard you talk about optimism. I think you were talking to people who have family members who have severe mental health crises, and you said to them, you gave them like a 10-pointer for 10 things that you think are important for them to embody, to understand when they're dealing with people with mental health crises. And you said one of them is to try to maintain even a drop of optimism. And that's something that really resonated with me, and it's something that stayed with me throughout this entire period of war, is that I felt like optimism is so important. It's so easy to feel so pessimistic about everything that's going on. But for me, optimism is contagious. And so there's always something to be optimistic about, right? Yes. So you came in with a smile, and I assume the smile is with you a lot of the time throughout your professional career. And is it something that's innate for you, or is it something that you have learned, this optimism about life?
I think it's innate for me. In the most personal way, I think I've learned it from my father, who is a Holocaust survivor, and never lost his, and never losing now, he's with us, losing his optimism. And he and all of his family, his brother and his other more distant family members have built here wonderful families, and they never forgot the shadow of the Holocaust, but more importantly, they never forgot to nourish an endless amount of optimism. So I'm doing the same, basically.
This leads me to probably what's going to be among one of the topics we'll reach to at towards the end of our conversation, which is a term that has become popularized in kind of these circles, which is post-traumatic growth, which is something so beautiful, because post-trauma, post-traumatic stress disorders are words that are so terrifying. And there is such beauty and redemption in knowing that out of post-trauma can flourish something that allows a person to grow beyond what they may have ever reached if they hadn't gone to the trauma in the first place. But I'd like to go back a few steps and ask you how you got to doing what you do. What do you think it is about your story, your DNA, your personality that led you to being the head of a psychiatric hospital, one of the leading ones in Israel, dealing with some of the most severe mental health disorders, such as schizophrenia and psychosis and post-traumatic stress disorder and many others. And perhaps you can also tell us about the anecdote that I heard you mention about your mother not really believing in any of these mental health diseases as being diseases, and rather thinking that, for example, someone with depression, she said once to you, why don't you just give them a ticket to the cinema? I'd love to know how you came to be, within that family context, the head of this hospital.
So maybe I will start with my mother, who is really a very dear figure for me. And just a small story, several weeks ago, Boaz Shalgi, who is a fellow of mine, and myself held a debate in Beit Zioni America about a very interesting question, whether the mind is someone ordered, whether there is an internal order in the mind and whether you can decipher it, or whether it's all, moving in a certain flow that you cannot really trace how it works. Boaz claims the second option, I claim the first option, and my parents, my father and my mother, have been in the debate, and at the end, my mother told me, Shlomo, this is really interesting. And thanks God they are in good shape. They are 89 and 91. And I asked my mother, maybe this will persuade you to trying to go to therapy, just to ask questions. So she looked at me with her beautiful, deep blue eyes and told me, listen, Shlomo, I'm 89. I don't have time for such bullshit. It seems as if she's very stubborn in her opinion about what I'm doing. I think that her dream was that I would be a cardiologist or something like this. But basically, if you ask me, I think it's like a certain kind of a destination that was imposed on me. At the age of 12, I've seen a picture in a Time Life series. You're too young to know this, but there was a Time Life series, and this was a book about thinking, and there was a chapter about madness. And the opening picture there was the picture of Philippe Pinel, who was a psychiatrist, a French psychiatrist, towards the end of the 18th century, taking off the chains from the mentally ill in Le Salpêtrière, which is the largest psychiatric hospital in Paris. And I remember that I've seen this picture, and it struck me really. I think there's also something narcissistic in this, because he's standing there and there is someone who is kneeling beside him and kissing his hand.
And he's the liberator.
He's the liberator, yeah, the great liberator. But since that time, I knew that I will be a psychiatrist. I knew that I will deal with psychotherapy, with dynamic psychotherapy. I had several turns in my life. I've been a long time in the army, and then I've been at the Weizmann Institute and did my second or third degree there. But I never changed my focus. And personally, I feel that I'm very privileged to be psychically hosted by persons who are really in the most extreme places, mental places, or emotional places persons can be. And I'm there, and this is what I'm doing. And I'm trapped.
Yeah.
Yeah.
In a good sense.
In a good sense, yeah.
Yeah. What would you like the public to know about Shalvata? When people hear Shalvata, the mental health psychiatric hospital, for a lot of people, I assume it immediately invokes images that we came across, or movies, or inner fears that they have. What is something that you would like to say to kind of a general audience about what this place is, what it means, and what it does?
First of all, I would like people to know that we offer much help to persons that suffer from severe mental illness. Almost all the patients in Shalvata are in the hospital for a very short period of times, and then they go back to their lives. They have difficult lives, but they do live full, meaningful lives, which is wonderful for us. There are these very extreme patients that stay with us for longer times, but that's really the exception. So first of all, I would like people to know that psychiatric illnesses, even the most severe illnesses, schizophrenia, severe bipolar disorders, severe borderline personality disorders, I wouldn't say that they are curable, but they are manageable in a way that our patients really live full life. And the second thing that I would like people to know is that Shalvata has more than 700 employees that are totally devoted to go to the most horrifying places that human beings can be there, and hand by hand take our patients out of there. All of them are extremely devoted. All of them could have been in their private clinics working with much more fascinating startupists, philosophers, teachers, but no, working with persons who are broken from their inside. And this is something that I admire in all of these Shalvatists who are doing this job. It is something that you can not underestimate in any way. It's amazing.
Yeah. So being surrounded by people who you greatly admire and respect, I assume, is very nourishing for yourself, seeing these people who are really willing to go very, very far in their dedication for people whom very often the rest of society is preferring not to look at.
Right.
Would you say that on this podcast, which I started shortly after October 7th. Therefore, we talked a lot about trauma, post-traumatic stress disorder as a result of October 7th. Would you say there is a Shalvata pre-October 7th and post-October 7th? If so, what have been the main differences? And has anything changed in the way that you look at trauma as a result of that devastating event and subsequent 2 years of war that we went through?
These are two different questions. The first question is about Shalvata, and the second is about my view over trauma. Concerning the first question, no. The core of the Shalvata Mental Health Center, which is the hospitalizing words, did not change. And the reason is very simple. The amount of suffering, of incoherence, of bewilderment, of all the things that are not clear for us, that typifies our patient, is much bigger than what happened in October 7th. I know that for us, as a society, as a community, October 7th is a breakdown, it's an earthquake that changed everything. Psychosis is much more than this. It's something which is much more terrifying in a sense. For example, our patients don't care so much about what is happening outside. You can see this, for example, when there are these sirens, and they go down to the shelter, but they look at us as if, come on, are you serious? This is what you are being afraid of? So
I'm laughing not because it's funny, but because I imagine the cynicism of those patients looking at the terrified doctors.
Right, it's amazing. But what has changed is our clinics that are widespread around Shalvata that now have much more post-traumatic patients. This has been changed. So our hospitalizing part is quite stable, but the clinics have been enormously changed.
I assume the clinics have been inundated with an amount of trauma patients since October 7th.
Either directly, post-traumatic patients, or indirectly. A wife of a soldier that did almost 2 years of army service and has her own problem and now has to take care of her two children, is more prone to destabilization, to depressive episodes, and we take care also of her. So we are taking care of the post-traumatic patients, but also for their surroundings, and these are very large numbers. Concerning this question, the second question about my view about trauma, yes, it has been changed. I never imagined that we will see such a thing, not in quality, not in quantity. But I must say that my view over trauma has changed not because of my profession as a psychiatrist, and not as the manager of the Shalvata Mental Health Center, but as the father of Yotam, who has been at the October 7th, has been a soldier in Gdud 51 in Golani, in Kissufim, and for 1.5 years lost many of his friends. And
just to say that Kissufim was one of the places that were directly affected.
Basically, but it was conquered by
by Hamas.
By the Hamas. And
your son was there on that day?
Yes, yes. And this really affected me, my wife, Anat, and myself very much, and also our 3 other daughters, Eden, Shira, and Yotam. And this was really something that changed everything I knew about trauma. It was really a real change in perspective.
It was intimate.
It was very intimate. It was, I used to think about trauma as an analytic project. You have to understand trauma. You have to process the trauma. You have to integrate the trauma, and let's do it. And suddenly I understood, I knew it before, but suddenly it was very clear for myself that the real anchor point of trauma is not things that you think about, that you know, that you order in a way. It is something much deeper that has no words. It's beneath or between or above words. And it is something that connects you to the non-communicable areas of your psyche. And that was a great revelation for me.
You wrote that trauma is something that the psyche cannot integrate. It can't digest it, just like we can't digest some foods. It can't translate it into words or into a coherent narrative. Is that correct? And if so, is the treatment of trauma to try to put words on it and to create a coherent story, or is it more to accept that there is no way to understand this level of trauma, these kinds of events that we sometimes term evil, like we term the Holocaust evil, beyond human comprehension?
I think that it depends. For me, it is very easy to think about the human psyche as working in 5 dimensions: actions, thoughts, feelings towards the others, experience with myself, and being. And I think that our therapeutic modalities try to touch these dimensions. For example, if I am avoiding from doing something and my therapist expose me to this trigger, then this is actions, okay? Thoughts is the way I'm thinking. Cognitive therapy deals with thoughts. If I have a post-traumatic basic assumption that the world is cruel, is bad, you can't trust anyone, then my therapist will help me to reprocess these cognitive assumptions and reshape them, okay? And then you have what happens between persons, emotions, feelings. This is what IPT does, interpersonal therapy. It doesn't deal with what you are doing or with what you are thinking, but with what you are feeling towards the other. For example, if I'm a PTSD patient who lost trust in human beings, then someone has to help me to recover from this. So this deals with feelings. And then we have these 2 deeper dimensions, which are experience, the way I'm thinking with myself, what I experience with my own self, and the way I am in the world, my being. And this is usually dealt, these 2 dimensions, experience and being, are usually dealt directly by dynamic psychoanalytic psychotherapy or by other modalities, your modalities. For example, the modalities that are associated with mindfulness are diving into being and experience in a wonderful manner. So it depends. Some of our patients will need intervention, which is with their actions, some with thoughts, many with their interpersonal relationships, and some will need to go even further down towards their experience with themselves and towards the way they feel they are in this world. And this is what we are doing. Basically, I myself, I'm speaking as Shlomo, not as someone that represents something. I have huge belief in the power of the individual to pull himself out from such disastrous places. So I don't see myself as the person who does it. I see myself as a facilitator. It might be very, very difficult for a soldier to be in this area in which he examines what he experienced with himself since he was exposed to all these horrifying things. But when I am with him there, it is much easier for him. And this is what I'm doing. Mm-hmm. My profession is to be with affected human beings that are unable to bear what they should bear in order to continue their life, and to be there with them, first of all, not to let them be alone, and then to move away from this into more functional dimensions.
At this point in time, what would you say is the main mental health challenge in Israeli society? And has that changed since October 7th?
Yes. First of all, it's a well-known fact that the processing of trauma has a very typical dynamic in time. So things always changed from the first day to the first week to the first month to the first year to the first decade. I remember that on October 7th, when we were all struck with all the news and we were so concerned with Tom and his friends, and at the end of the day, towards the end of the day, near midnight, we made the first emergency meeting in the management of Shalvata. These are 6 persons. We sat together and we tried to understand what will happen. Then we said that we will need 2 days just to take our breath, 2 weeks to understand what is happening, 2 months in order to become effective somehow, 2 years in order to prepare ourselves to heal what we have to heal, and 2 decades to finish the job. And we are doing this. This is exactly what we're doing. If you will ask me today, what is the most important challenge of me as a therapist, of Shalvata as an institution, of the Klalit as Kupat Cholim, who takes care of more than half of this country, and of the Israeli society, I will very clearly tell you, promote post-traumatic growth. That's the most important thing to do now.
I was thinking that you would say the word resilience, but I think they overlap.
It's all the same. Resilience is your ability to stabilize yourself and move forward. Post-traumatic growth means something which is more complicated. It means that you acknowledge the fact that there is a trauma, but besides this trauma, there is something that starts to grow. It does not eliminate the trauma. Nothing is being erased. No one will erase the sights, the sounds, the smell of the things that we all experienced during the beginning of this war. But if we will be able to contain it, somehow to contain it in an efficient way, and to let just beside it something else to grow, this will be wonderful. For example, I'll give you a small example. Now there are many hostages that are being interviewed, and you listen to them, and you see how courageously they have the trauma, and just beside it, there's something else. They're growing something else. And that's the most important thing that we have to deal with now.
That emergency meeting where you said you talked about the 2 days, 2 months, as you were saying that, it almost, I imagined U.S. prophets, and even though that, that is probably a narcissistic inducing word, but for me, it really matched that. So, you were right, at least for me, in that for 2 days, I was non-functioning. I mean, maybe I'm exaggerating, but on many levels, I wasn't functioning. I was almost like a terrified animal in all the fight and flight and freeze modes. And I felt like my psyche was falling apart. Just the terror, not being able to make sense of what was happening and how my body was reacting to it. And then we went abroad, and I think you said 2 weeks. It took me about 2 weeks for there's this talk in some kind of mindfulness or wellness circles about the idea of these animals who go through trauma. They're almost eaten by a lion, and then you just see them shake it off. And there's this inherent bodily wisdom of shaking it off. And the fact of being abroad and being in nature, and for me, breathing deeply, nurturing myself, was that kind of like shaking off of the trauma. And about 2 months later, that's when I started this podcast where I was able to start, I don't know how you called it, trying to make sense, to help in the kind of collective, not only just nourishing myself, but I had enough resources that I could feel like I was helping in my own small way. And then here we are 2 and some years on. And so I want to talk about this period that we're in now. There is this idea for the whole time that we were in the war that it's very hard for healing to happen as long as we are still in the event. And I spoke to a lot of therapists and psychiatrists who said it's very hard for a lot of these people who have PTSD to heal as long as there are still hostages in Gaza and there's still soldiers being killed and there's still all this devastation and this dehumanization also that we see all around the world, and in our politics. So it's very hard. It's like it's keeping these people hooked. Now that the fighting has more or less stopped for a few months, would you say that we are in a period where you feel we can start healing, or are things still very, very tense?
I think that things are still very, very tense because of many reasons. 2 important reasons are, first of all, our internal condition, who is still divided as a society, and we are still in a state that has been there before October 7th, but something there is still very uneased. And the second thing is that I think it is very important not to think about trauma just as the trauma per se. For example, I myself extremely bothered by moral trauma. Things that we have experienced, things that were done to us as victims, things that we have done to others, to innocent others, and this will never stop. I mean, we will still there. We think about it, but basically, I think that the fact that all hostages are back and the fighting are a little bit subsided. This gives us a great chance and a huge responsibility to promote post-traumatic growth. We should do it. Several months ago, Soroka Hospital got a missile from Iran on one of its central buildings, and the building was totally ruined. And Soroka, the personnel are so brave people. You can't imagine what these persons went through since October 7th. And they still have many post-traumatic patients who are from the staff that was there at 7 o'clock in the morning. And we the Shalvata staff, we take care of them. We open their clinic. I myself go there every 2 weeks to take care of them. And I had someone who was stuck in therapy. And although his symptoms were much better, he was unable to move forward. And we had many discussions about it. And then I had an idea, and I told him that I asked him whether he could help me with something. And he asked me, of course, what do you need? And I told him that I have another patient, a female patient, who is a Bedouin from one of the villages around Beersheba, and she's unable to enter the gate of the Soroka Hospital because she's avoidance. And asked him whether he could help me and every day go to the gate and take her inside the hospital, expose her a little bit, and put her back in the gate and let her go. And he said, yeah, of course, for sure. And he did it, and he did it very punctually, and he helped her very much. But the amazing thing is that he himself is much better now. He found something that allowed him to experience himself as effective, as healthy, as supportive, as proactive. And this has done wonderful things for him. This is the story of post-traumatic growth. The reason to promote post-traumatic growth is not to eliminate the trauma, but to manage it better and to go back to the railroad of life. And this is what I think is the most important thing to do now.
I'm so glad you shared that story. It's first of all, I felt my hair-raising because it's a very emotional story. It's a beautiful story. And I think one of the things about trauma is it makes you so much more sensitive to the difficulties, to the pain, to the tragedy, and also the beauty. And so one of the things that I think has been a thread going through all my interviews with a lot of experts is how much the ability to help others in smaller ways or bigger ways has been such an important aspect of healing people throughout this country. And we saw it very clearly in the beginning of the war when people, my parents, Olim Chadashim from Belgium, who had never toiled or dealt with any agriculture or never dirtied their fingers, or going and putting these plastic hats on and sorting through strawberries or other kinds of produce. And people just, they got up and they helped. And there was something in that was so moving, both for society that was looking at these people, so inspiring. And there's something, if you'll perhaps agree with me, about trauma, about a heart that has been broken, that also allows us to really have compassion once you've gone through a little bit of healing yourself. Is that something that you relate to?
Yes, I relate to this. I will stress one thing. I think that it is very important to be able to help someone, but the most critical phase is preliminary to this. And this is just being with someone. I think that I helped my patients, my post-traumatic and other patients, psychotic, suicidal patients, in many ways. But if God will decide that at the end I will go to heaven and not to hell, is just because I was courageous enough to be with them, not to help them, just to be with them in these terrifying areas. It's the areas of post-trauma, of death, of moral injury, of psychosis, of the decomposition of the mind during severe mental illnesses. Being is preliminary, and it is the most difficult task for us as therapists, and maybe also for us as a society.
Yeah. I often make parenting analogies, and I think parenting has taught me so much that makes me understand a little bit when therapists talk about this being with, is this idea that over time, as my children are becoming older, I'm learning that perhaps the most important thing when they're having a tantrum or a breakdown or acting from a place of rage or frustration or lack of confidence is not to try to go and resolve things, not to take them out of the house and go buy the thing they wanted, or not try to resolve the dispute that they've had at school, or talk or do or try to get them out of where they are. I find that the times where I feel like there is something that kind of softens in them is when I can just be there, and just really witness these very difficult feelings that even children really judge. They judge that rage that they have, and they judge the jealousy, and they judge the smacking of the little brother. There is already that feeling of I'm bad, or it's very scary. It's very scary for children to have these very big emotions, especially when parents can't contain it. So that's something that, I've really worked on, is just to kind of be there as the container.
I will go even further, not just be with them and contain them, being container. I will go further on and will argument that the most important thing is to be able to absorb what they feel and really be there with them. We're not outside this ditch in which they are situated. We are jumping inside this hole with them. It's like if you think about as a mother, think about this moment in which you are speaking with a child with a childish tone, right? So you're not just understand that he or she are speaking in childish, you're with them. You're speaking from your internal childish self, and this is what helped. And the problem is that these post-traumatic selves or these suicidal selves or these psychotic selves are very, very difficult to be in. And if you accept this duty to let this contagious effect happen, and you really accept it, this brings a lot of compassion and therefore has a very strong therapeutic value.
Yeah. I'll make, just because it's what I know, I'll make the analogy with parenting again. What you're saying essentially is, for example, when my daughter is acting in a way that is enraged and throwing things and, pulling her tongue out at me and crying and really showing me her darkest mask and saying, are you still going to be with me while I'm showing you this? It's not just those moments where I can be with it. It's also those moments where I feel that darkness in myself.
Exactly.
I remember that I have this rage and jealousy, and I'm sitting in that ditch with her. And the reason I'm saying this is because I know just with 3 young children how difficult it is to, when I have my daily life and things to do and these judgments also about these behaviors, it's so hard for me to accept to take me out of my, currently balanced state because I've just done a meditation and go in that really dark place with her. And I might also imagine that if I didn't have the very strong core and resilience, being in that very dark place with her, or in your case with patients who are really in the darkest, most terrifying places, might affect you. You're talking about contagion. How do you protect yourself? How do you, as a therapist, but also maybe more broadly, us as a society, knowing that we have these people who are suffering so deeply, how do we not only say, okay, we know, we've heard that trauma is acceptable and, we tolerate you, but we're really scared of you. I really don't want to get close to you because it's so scary for me. I don't want to be contagiously affected by it. How do you stay with it? And how can people more broadly stay with it?
Before answering, I would like to stress one point.
Sure, absolutely.
And this is there is great difference between the scene of being a mother and a therapist. You are as a mother, Anouk, you are destined to be a mother. Your biology, the oxytocin that you had since breastfeeding until now, destined you to this job. You have to remember, the therapist has to decide to do this. It's very, very important to acknowledge how courageous is for therapists, for my 700 colleagues in Shalvata, to decide to jump into this very dirt pond of human suffering. Simone Weil writes that the real freedom is not to be able to choose between things. The real freedom is to be able to devote yourself to a necessity. And the fact that therapists are devoting themselves to necessities of others who are not their children is very important. I mean, that's the core of what we are doing. So we are taking all these, not really contagious, but not so far away from, we're taking this to ourselves. Know what helps us? The others. What helps us to maintain ourselves balanced is the fact that what helps myself to balance myself is the fact that I have so many extraordinary colleagues in Shalvata, in other hospitals, and the fact that my family, and not my wife, my children, acknowledge and respect my decision to be part of this journey. And this is the most crucial thing. I couldn't imagine how I could do what I'm doing today if I didn't have this a support system is
Community.
it's too minimal to think about it as a support system, but something that can, detoxify myself at the end of each day. And this is very important for us as therapists.
I assume that after October 7th, you may have had an increase in patients who were soldiers, who were reservists. What are some of the cases that you see, or what are the most prevalent cases that you see who come to your hospital? So I assume are in very great difficulty. And how does that maybe differ from people who, through other reasons, may have psychotic breakdowns or depression or suicidal thoughts? Have you created a new protocol for dealing with soldiers who came back from reserves, who either develop PTSD? It could be a whole range of reasons, I assume, and you'll tell me that it can be either from being exposed to one very traumatic event, either where something happened to them or to their friends, or even, like you mentioned, moral injury, which is something that I think will come up more and more, about having done things that they have a hard time living with, or whether it is the kind of continued exhaustion of going back again and again and again for 2 years. How are the protocols different with soldiers, and what are some of the most prevalent stories that you see?
So first of all, it is important to say that most of the patients with PTSD do not come to be hospitalized. They are treated in our clinics. They do not come to Shalvata. They come to Kama Clinic, which is a specialist in PTSD, or to our other clinics. Usually in the hospital, we don't see PTSD patients. We see other patients who have severe mental illness. And in that sense, the hospital is quite the same. But it is very difficult to typify who are the patients, who are the post-traumatic patients, and what is common to all of them or to most of them, because, PTSD is a title. It's a title that you are being qualified to have PTSD because you have symptoms, not because something else. And the symptom says nothing. Symptoms are third or fourth degree reflection of something which is very deep, and it is not measurable by symptoms. But I think that while in the beginning we have seen patients with traumas, what we see now are more complicated cases in which trauma is being blended with moral injuries, with comorbidities, with the byproducts of drug abuse, which is an essential part in PTSD, especially today in Israel, and of the collapse of support systems. So it is much more complicated now. Still, it is something that we know how to hold. We know how to contain. We have many protocols. Some of them are dealing with what the patient is doing, some of them with what the patient thinks, feels, experiences, or the way he is in the world. And some of them are integrating all these things together. And most of the things we're doing quite a nice job. I mean, it's very important for me that this optimism that you spoke about in the beginning will be held throughout our contact with PTSD. This is a manageable situation, and if you are brave enough to manage it, you can go on. You can continue your life.
If we talk about a definition of PTSD, among others, is it a kind of inability to process what happened, and also a reality in which the trauma or the complex traumas still live in the present moment? Or are there other things that you would qualify as the definition of PTSD?
That's the common definition of trauma that affects human beings and turns them to be post-traumatic. Our inability to process trauma, to symbolize it, to process it, to manage it, to go further from it. That's a very common definition, and it's very correct. You're defining it very nicely.
During these 2 years, a lot of the talk has also been about kind of like alternative and new methods of dealing with trauma, such as psychedelics, somatic therapies that deal with the body. As you said, sometimes it's so hard to put things into words. Perhaps dealing with the body might be one avenue. Is that something that you've dealt with, or do you still kind of like mostly believe in the tried and tested ways of working with this very complex illness, if we may call it that way, that I think you once said, is not at all like a sore throat. It's not something that you can, it's not a one size fits all disease. It's something that does require a huge toolbox and a lot of flexibility. But does that also include those kind of new modalities and testing new things?
It's not a matter of belief. It's a matter of capacities. I'm sure that working with the body, somatic experience, I'm sure that using psychedelics and psychedelic-assisted psychotherapy, and I have no doubt that exposure therapies and cognitive processing therapies, I have no doubt all of these can be effective. I'm not doing them because of one simple reason. There is something that I do believe deep in my heart as a human being and as a therapist, and this is where I'm aiming. And my belief is that in order to confront with, deal with, manage the unverbalized parts of human beings, the most important thing is someone else who will be able to be with you and work in these areas. And this is what I am doing. In that sense, you can tell me, Shlomo, if you will use psychedelics, this will be a faster process. I will tell you maybe, but I know how I do it. My profession is to deal with the unthinkable by being with someone in these very primitive mental states. This is what I am doing as a dynamic psychotherapist. So I'm cherishing all the other techniques, but I'm trying to use what I'm doing the best. In that way, there is this metaphor that Isaiah Berlin brought from ancient Greek about the fox and the hedgehog. I'm the hedgehog. I have one trick, but it is extremely complicated, and I think that I have the courage to do it quite nicely. And this is what I'm doing.
I think it comes back to what you mentioned about being there with and experiencing with, and perhaps what you're saying is there are so many techniques, and they might all be great for certain people at certain times, and also not every person experiencing PTSD or other mental illnesses will need the same set of techniques. But ultimately, again, what you're saying, what perhaps our brain, if we look at it from an evolutionary standpoint, what we first may need beyond being fed is that connection, is feeling that we are part of something, that we are not alone, that someone is there with us. And I can imagine, although, I don't like to imagine it, but I can imagine that if I were to go through some of these most difficult, most kind of most horrifying of mental illnesses, that I would need someone to be there and to say, you're still among the living. You're still part of our human species. We don't cast you out, which is the ultimate death sentence for evolutionary primates, is to be left out of the pack. In your sense, by being there, the whole 700 Shalvata staff, you're saying you're still part of us. Your existence means so much. And in fact, it shows a different color to the human spectrum of what our brains can do, both the difficult and the beautiful.
Did you notice, by the way, that you have lost your words and your line of thought when you just tried now to explain what is this place? You started to, it sounds very fuzzy, right?
Yes.
And at the end, you didn't speak about yourself. You spoke about us. My profession is not to lose my senses at these exact points and to stay there, not to speak about us, to speak about me and you as a therapist. It's a very strong example of how when you just try to speak about it, you're losing your mind. This is where I'm situated.
Yeah. Well, if you were my therapist, then maybe we would go into shame and how
I would
just
go so
by
far.
associating myself with with these conditions, there's a lot of fear, there's a lot of shame. And I'll tell you a little anecdote from this morning. I was listening to this talk that you gave to families of people who have family members who have these very, very difficult mental health conditions. And as you were talking about all these symptoms of PTSD and telling the family members how they can be with all the kind of different things that they can do to make the life of their loved ones easier. And then you ended beautifully by saying the most important is to take care of yourself. It moved me so much. And at the same time, it terrified me so much that I went to take Clonex.
Wow. Sorry. I didn't mean to.
And there was a whole internal dialogue, there was like the whole, kind of psychoanalyzing myself of saying like, you're feeling shame about, going to talk about mental health and yet you need to take a Clonex. You're not good enough. And there's the imposter syndrome. And at the same time, there's the idea, no, he's probably, if I were to tell him this story, he would probably appreciate that I can be honest about it. It's even listening to you. It's such a hard topic for me to listen to, even though it is so fascinating and interesting because it brings up the most extreme parts of ourselves, the biggest shadows, that most of us don't want to face. And you really are facing it.
I think if I think about it, I think the most dreadful thing for me as Shlomo is to find myself psychically totally alone. When I was a child, I always speculated what would be more difficult for me, to understand that there is someone living outside our solar system in extraterrestrial lives, or to be totally alone here. And I found the thought of being left totally alone is unbearable. It's really, I'm just thinking also, about the total biology of this. Just think, let's go back to motherhood and parenthood. Just think about this miraculous baby who just went out from his mother's body, and the first thing that he or she are doing is looking for connection. It's amazing. It is amazing that at the age of 2 days, a small child knows what is the odor of the milk of his mother, and he knows to differentiate it from another milk of another mother. Or he or she knows how to identify the cologne of his mother. I don't know how to identify a nut's cologne after 30 years of marriage. How does it do it? So all the biology is being built in a way that as if it is as if it understands that human connection is a determinal factor for us. And when this shakes due to psychosis, post-trauma, whatever, the most important thing for us to do is to be there, really be there, not just helping, be there emotionally in order not to leave persons by their own. If we will be there, probably everything will be okay.
It made me think of when I gave birth to my second child, and they put the baby on your stomach, and the midwife, who was older and just has this wise presence about her, said, like, don't move her. She's going to make her way towards your breast. And it was just extraordinary to see this infant that is born with all the instincts to move in the direction of her mother's milk. And that connection goes both ways. Like you mentioned, the oxytocin of being with a child.
I will give another amazing fact. It's either evolution is so genius or there is God. It can't be by chance. You know that when a child is born, he barely sees, but his or her focus of the eyes is approximately 20 to 22 centimeters, which is the exact distance between his eyes and the mother's eyes while he's breastfeeding. So you think about who the hell thought about it? Who gave who gave this idea of aligning these eye-to-eye contact while you are breastfeeding? It's amazing. We're doing the same, but we're doing it not with infants. We are doing it with broken souls, and this is so difficult. And when we are doing this is why it is so many times so advantageous.
Looking at the kind of general population, not people who are, we don't expect of them to be willing to kind of dive into the pit of fire with the most broken souls, but either the person who has enough resilience to go about their daily lives and feel like they're functioning well, or someone who is kind of mildly affected by the trauma, either of October 7th or the so many million other options for traumas that we have in our modern world, whether it is, childhood trauma or just the trauma of expectations in this life. What are some of the things that you think are most important for people to know, both people who might be available for others but feel like they don't have the tools, and for people who are struggling, maybe are having difficulty sleeping or have a lot of anxiety, a racing heart, or feel a little bit empty and depressed about the state of the world, or have kind of like coping mechanisms that don't serve them, overeating, consuming things that they would rather not be consuming. So the people who don't come to Shalvata are not the most extreme cases. What would you want them to know if they were to hear, maybe one or two sentences from you?
I will give two contradictory tips, and each one will take care to all of them. The first thing is trust the process. Trust the process of us as human beings to be resilient and to shake all these terrible things and continue life. Trust the process. And the second thing is seek help. I think, and these are two contradictory things, because if you trust the process, why to seek help? And if you seek help, then you don't trust the process. But you have to combine these two for yourselves and for your beloved ones. And this is also very important. Once, not many years ago, I went with Anat and we were wandering Neve Tzedek, which is a neighbor in the south of Tel Aviv, and she entered a clothing shop, and I sat there, with nothing to do because I have nothing to do in clothing shops. And then I had a phone call from Shalvata, and I spoke in the phone, just something very procedural, and then the mocher
The salesperson.
The salesperson, a male, came to me and asked me, "You're the psychiatrist?" And I said, "Yes, I'm a psychiatrist." And he told me, "I need an advice from you." And I told him, "Okay, ask."
He recognized you from somewhere?
No, he heard that I spoke with
okay.
Shalvata, so he understood that I'm a psychiatrist. And then he told me that he had a motorcycle accident, and he has very mild symptoms, and they are becoming better, but he wants to sue the insurance for this. And do I have any tip to give him? So I told him, don't sue. Don't do it. Just say thanks that everything is okay and continue your life. I know that it sounds a little bit peculiar because maybe you can get some benefit, or maybe you should acknowledge your symptoms, but it seems as if you are in a good shape and you are becoming better and better. Try to focus on yourself getting better. For several years, every Rosh Hashanah, he sent me a bottle of wine for the good advice. And he told me, as time elapses, I understand how fortunate I was not to deal with it too much, just to trust the process. This is what we are as human beings go through. And in many cases, you can't trust the process, and then you have to seek help. But I think that you constantly have to balance these two things: trust the process and seek help if needed.
Yeah. So if I can kind of summarize it, perhaps you're saying that the trust yourself is the kind of trusting in the innate ability of our millions-year-old psyche and body to just like a flower goes towards the light, to go towards healing, and to maybe not get terrified when we have a few nights where we can't sleep, or like me, get absolutely hypochondriac and think that I'm going to die if I, have a cold. Trust the process that most likely I'm going to survive this, congested nose. And on the other hand, also say, in very difficult periods, and I think these last 2 years have been very difficult, also accept that it's okay and beneficial to seek things that are beyond the just trust the process. Meaning, for me, I think it can be seeking therapy, but it can also be actively seeking out more ways to move your body, to perhaps do some practices such as gratitude practices, mindfulness practices, traveling, sometimes getting out of this country. I always find that the perspective I get when I leave Israel is always so much more, where I realize, oh my God, not everybody in the world is anti-Semitic, and not everybody is thinking about what we're thinking about. And for a few days, I forget about what happens here. There's so many ways that we can kind of push a little bit outside of our comfort zone in a direction of well-being. And that kind of like increased nourishment also allows us, I think, to be there for others. So for me, it's always like, I think in post-traumatic stress disorder, you talk about all the symptoms kind of increasing and one another, but in kind of like a cycle of well-being, it also nourishes one another. What are some of the things that you do in order to feel full and resilient and strong and optimistic?
Very few things. I'm sorry to disappoint you. I do not meditate. I don't take any substances. I think that 3 things protect me. The first thing is that I have my strict schedule during the day. Most of the physicians, doctors that work in the public health, either mental or other, have to have such a schedule because we're starting to work very early, and we are, we have our schedule in the hospital. But this encapsulates me. It keeps me in shape. The second thing is that I'm trying to do sport every morning. I'm not a sportman. I never ran marathon. I never ran half marathon, not even 10 kilometers. I ran 5 kilometers almost every morning. and it gives me something that puts me together, and it's very good for me. So it's having strict schedule, taking care a little bit of my body, and creating things not from the organizational point of view. I'm not building units. I'm not doing huge things in Shalvata, but writing a book, which I've just published now, or trying to initiate thoughts about the way we are taking care of trauma. Balancing these three things, I think, protect me. And this, with the addition of a very strong supportive system. And I think, by the way, that this is something that you hear a lot with your in your podcast. Many of the people that you host will tell you this, that they have very strong supportive system that helps them to keep on. That's a good conclusion for all of us. Let's support each other, and let's continue to grow up.
And just maybe one or two final questions. The amount of people in this country who are taking medications for anxiety, for depression is really exploding. I mean, it was already high. It's higher now, whether it's SSRIs or more kind of like immediate stress reduction pills like I like to take, like Clonix or Xanax. What do you think about that? Is that something that there is still a stigma around it? There is still a shame around it. I myself feel this kind of slight embarrassment when I say it. How do you view those medications in the kind of like general population in a world that is so complicated?
I think that the stigma is much less now. I think that harsh times invite much more medications, which is okay. I think that I have nothing against suffering. I have a lot against suffering that disable you from taking care of yourself. So if you are taking medications just in order to feel better, I find it a little bit problematic. But if you take medications in order to allow yourself to promote post-traumatic growth, to promote self-relaxation, to allow yourself to sleep in order to regain your powers during the cycle of the day, I think that's okay. We have to remember that some of our medications have many side effects. Some of them are addictive. So it's another component in the way we see these medications. But basically, I always tell my patients, if you take this medication as part of your growth, as part of your healing, as part of your rehabilitation, that's okay. I'm with you.
And if we talked about hope at the beginning, and to finish on a kind of word of hope, what is something that either gives you hope or that you think should give us hope as a society?
I look backwards at my parents who made huge transformations. My father from the Holocaust, my mother from Egypt, as a young, very young child who came here to Israel as Ola Chadasha. So I look backwards, I look collateral to my friends, and I look for the future in the eyes of my daughters and my son. And basically, I can see nothing but a lot of hope.
Thank you so much, Shlomo, for coming in. I really appreciate it. And maybe we'll do a part 2 in a few months.
Thank you for the invitation. It was very interesting for me.
Toda rabba.